Hello, I'm Oshini.
Hi, I'm Bernard.
Integrated care is a concept that is now widely used around the world, which may be the best suited for those with medically complex needs due to long-term conditions.
Let's explore this model using a case scenario.
Meet Mrs. Ricardo, an 86-year-old from a non-English speaking background.
She's having frequent hospital admissions due to exacerbation of heart failure and general decline in health.
She has heart failure, atrial fibrillation, and left-sided hemiparesis.
Sarah, her daughter, is the only carer and she's not coping well with her mother's increasing demand of care at home.
Now she presents with difficulty breathing, decreased mobility, and increased incontinence. She's also becoming non-compliant with care. Let's look at the ideal care model for her.
In self-care model, consumers are expected to be independent enough to care for them at home with the minimal support of their families. However, as Mrs. Ricardo is having a self-care deficit due to her complex healthcare issues, she requires more support of her daughter Sarah. This care model is not the ideal one for her.
Advanced care planning is often used at the end of life or terminal care. As her conditions are managed medically well and she's not reaching terminally ill situation, we rather focused on collaborative care to improve her quality of life at this stage. Moreover, palliative care team can be integrated into Mrs. Ricardo's case.
Integrated care model is the ideal model for Mrs. Ricardo. Let's see why.
Clinical and other healthcare professionals working closely together in community, hospital and volunteer section to deliver care to the clients at their home.
They share information through holding regular meetings and documentation.
It also saves time, reduce hospital admissions, minimize costs and improve overall patient experience.
When we relate this to Mrs. Ricardo, she will have a case manager who will link Mrs. Ricardo to the required allied health professionals and services, such as general health practitioner and a cardiologist to manage her symptoms related to her heart failure. While physiotherapists can be involved in the mobility assessment and improvement, occupational therapists can also help her with alterations to equipment and her home.
Nurses would be able to make regular visits to do medication and assessments, while palliative care nurses focus on improving quality of life as she wishes. Moreover, speech pathologists and social workers can benefit her immensely to manage her condition.
Sarah, the daughter, will be provided with enough information and knowledge to support her mother at home while taking her wishes into consideration. Also, the case management can arrange other services such as ambulance service and hospital services.
Some of the barriers of the care are non-compliance of patient, communication and knowledge barrier, balancing expectations of all health holders, difficulty allocating time between services and ineffective family coping.
On the other hand, effective leadership role, sharing a common goal and having a supportive daughter, sharing of accurate clinical information in a timely, consistent manner, regular visits, family consultations can be considered as facilitators.
By effective care integration, Mrs. Ricardo will be able to manage her complex chronic conditions at home in a timely manner, preventing frequent hospital admission sessions and exacerbations while helping Sarah, her daughter, to manage her mother's condition at home.
Thank you.